Joining us now is Dr. Peter Beilenson. He is, forgive me, tell me how to pronounce your name again.
Beilenson.
Beilenson. He is with Sacramento County Health Department and Health Services, and you're here to give us a little bit of insight into coronavirus.
So lots of questions. Our viewers have lots of questions, but the virus, it's been in our community for weeks now. And a few tests early on, some of those were defective, so we didn't even know who had coronavirus and who didn't. And now we have 80% of cases, you're saying, are asymptomatic or no symptoms at all. And those people could also be spreading it.
They could be shedding the virus, yes.
So in reality, how many people in our community right now could have the coronavirus?
Well, it's hard to predict, but I'd say hundreds to a few thousand.
And that's a startling number. And those people could be spreading it at this point, too. They're not all in isolation.
They could be spreading it, although even if you have no symptoms or mild symptoms, you're less likely to spread the disease.
So we know at least 2,500 people just got off this cruise ship in San Francisco. Most of them, the governor just said, are from California. So presumably back home in various counties across the state. We know there are 2 confirmed cases from that cruise ship, one here in Placer County, the gentleman has died, another Sonoma County. How hard is it now to track down all some 2,500 of those passengers, and do we even have enough tests?
Well, and also the 1,000 crew members as well, as far as we know. So we have the people's information based on their the information they've given them before they've gone out on the cruise as to where they live, et cetera. So we can find out who they are and go down and go out and try and test them. The beauty of the new test being available now is that instead of just isolating people that we were doing before who were potentially exposed to people who were ill, we can now do the tests, and we should have probably close to enough to do the tests on all of them.
All right, there is a flu season generally every year. Is there such thing as coronavirus season now? As the weather changes, could we start seeing fewer cases?
Yes and yes. So what I think is going to happen, and based on 25 years as a public health official, is every few years we have a virus that comes out with a bang, it kills a lot of people or kills a decent number of people, and then it turns out that a large number of people actually have the condition and are mild or asymptomatic. And it becomes part of the constellation of infectious diseases in the world and comes back in a seasonal manner. H1N1 is a perfect example of that. This is likely as well to go away probably in the summertime, the spring and the summertime, as it gets more humid and as people go outside, and so they're not in confined areas as much. And my guess is that this will become a chronic condition, not unlike the flu or other viral infections.
And then real quickly, a lot of people have trips planned. Spring break is around the corner. That means going on a plane, going on a boat, going on a bus, going on a train.
Yeah.
What should people do about these vacation plans? Should they go?
I think probably most of the time people should go. I think we can't afford to let things close down our society. And because the vast majority of people have mild or no symptoms and recover well, they should be fine. The only caveat I might give to that is that for someone who's a senior citizen with chronic underlying health conditions like emphysema or something like that, I might hold off this year.
So underlying conditions.
And we've been comparing this a lot to the flu.
Yes.
What makes this feel different, at least right now, is the quarantines. You don't quarantine for the flu.
Correct.
As we see more cases, the death rate likely going to go down. Are we going to keep quarantining?
We probably won't have to as much because we'll be having many, many more tests. Up until about 3 days ago, all of the tests that were done were from the CDC, and we had to literally send them to the CDC in Atlanta and get them approved. With the thousands more tests that are out in the general population now in local health departments, and we have the ability to do several hundred cases, we'll be able to test people more quickly, and so therefore be able to quarantine less. Because if someone's is exposed to someone who has the virus, let's say, instead of that person having to go in quarantine, we can test that person to make sure they didn't get infected.
The testing will change that then.
Yes.
All right, well, we appreciate you coming in. There are so many questions out there, and I know that tonight you're going to be at Sac State where there's going to be a forum where people could ask their questions.
Yes.
That starts at 6 o'clock. You're expected to speak. The president of Sac State and the mayor of Sacramento is supposed to be there. It's going to be held at the Union.
Yes,
And I do want to point out, we asked our viewers on Facebook to ask us some questions. He's getting a call about that forum right now.
Yeah.
Where are you?
We did, before the show, we did sit down and do some question and answers. We're going to put that on our website later on tonight. So a lot more questions and answers to come on CBS13.com. Thank you so much for your time.
Thank you.
Thank you.